powers and duties of the appraiser. And this statute is really what establishes January 1st as our valuation date. Tells us that we have to list and inspect the properties, and provides for the director to provide guides and services to us that we have to follow. 1401 establishes the Property Valuation Division of the Department of Revenue as our oversight agency. So they review almost everything we do. There's a process we have to fill out, quarterly reports that are fairly in-depth. We have to supply all of our information to them that we develop. They keep us on schedule. If we're not, we have to ask for extensions and things like that. But they have a kind of a supervisory role, as this indicated. 79501, this statute tells us we must appraise at fair market value. We don't have an option to vary from that. So we're required to reflect what's happening in the market, appraise property at fair market value, which is what a property should be able to sell for on the open market. And then 503A gives us that definition. We'll touch on that in a minute. 505, it tells us that our appraisals must conform to uniform standards of professional appraisal practice. We'll talk about that here in just a second also. 1460 tells us we must now mail the change of value notices on or before March 1st. And that is why we're here today, because we just sent out notices on March 1st. And then 1448 and 2005 establishes the appeal process. These are the informal process, which is what we're going through now, and the payment under protest statutes, that if you decide not to appeal at this level, you can appeal when you pay your taxes under protest, either the first half or second half. You get one of the options. You can't do all three. So that 503A definition of fair market value means the amount in terms of money that a well-informed buyer is justified in paying and a well-informed seller is justified in accepting for a property in an open and competitive market. It's pretty straightforward. It's a similar definition used for all appraisal services, bank appraisals included. In fact, the process that we go through is very similar to what they do, only we build models to tell us what adjustments there are, as opposed to appraisers using mainly just their expertise. So, and all of our information is again tested. And then USPAP, the Uniform Standards of Professional Appraisal Practice. This was adopted by Congress in 1989, and it was a result of the failed savings and loan institutions. It's to promote and maintain a high level of public trust in appraisal practice by establishing requirements for appraisers. This also contains our standards and ethics for all types of appraisal services. It's something that is required by the state of Kansas for us to comply with, and it's also required for fee appraisers, for bank purposes, for mortgage appraisals. So then we get into state oversight, PVD. We're held to the highest standards of compliance by them. As I said earlier, all of our information is submitted to them for review. They go through the process to assure that we're adhering to those standards and regulatory statutory regulations. Part of that is a statistical compliance. Sales ratio studies are used. We use them in our office to help us guide where our values are going. The state uses them after the fact to tell us how we've done. So they use sales that occur after the valuation date. So our valuation date is January 1st. They use sales that occur throughout the rest of that year to tell us how we've done. The most recent study that's complete was 2021, and the median ratio for residential was 91, commercial was 92.6. So to kind of explain this a little bit more and put it in perspective, an acceptable median ratio is between 90 and 110. A ratio is simply the relationship between appraised value and the sale price. So if you have a sell price above our appraised value, it's going to be lower than 100. If the sell price is lower than our value, that ratio is going to be above 100. Sitting at 91 and 92 for commercial, it's telling us our values are at the low end of acceptable. So our values are under what properties are selling for generally. And then the substantial compliance is just a combination of procedural compliance and the statistical compliance. And the county has been in compliance. I don't know of a time when we were out of compliance. So our office does a great job in maintaining these values and the processes that we go through. So that process, we are required to inspect every property at least once every 6 years. This happens more often when we get permits, sales information, splits. We're out there on most of those. So anytime someone takes out a permit, we need to go out and list that information that they're constructing. So if they build a new garage, we get a permit for that. House construction, we get permits for that. And then with the sales, every transaction that comes through Shawnee County, we review, analyze, and for every arm's length transaction, we're on site doing a full exterior inspection of the property. From that, we build models. We have models for just about every aspect of the appraisal process. Land valuation, comparable sales, cost approach with depreciation models, income and expense models. We derive important factors from that market to give us what these component pieces are worth. And then every model that we have has a written report that we also must submit to the Property Valuation Division. And then put it in the definition of mass appraisal, and it is just a process of valuing a universe of properties. And so to avoid any confusion, we are doing a mass appraisal here, and it is valuing a universe of properties, but we're valuing each one of those individual properties by itself using the models developed. So not every house is the same. They're all just slightly different. Even in a neighborhood of all identical homes, they're not all identical, so we have to adjust for the differences. And then the sale transactions are the very basis for our value indications and used in all three approaches to value. We have the cost approach, which is replacement cost new less depreciation plus the land value. We have a sales comparison approach, which is estimated using recent sales transaction, adjusting for the differences in the properties. With that, we also have, we use multiple regression to assist us in determining what the component parts are. How much is a bathroom worth to a house? How much is an additional bathroom worth to the house? So we have that kind of analysis that we use. And that also will develop an opinion of value. We also use a trend analysis. And then we have an income approach to value, primarily used for commercial properties, which is capitalizing the net operating income. And that net operating income is the income to the building, not to the business. So we're not valuing the business, so we don't really care how many shoes you sell in your shoe store. We care what that shoe store is paying in rent to the property owner. And that's what we capitalize into a building value. So we're not providing a business appraisal, we're providing a real estate appraisal. And then each one of these appraisals include a report, written report. So we have comp sheets for residential and a cost report, and for commercial we've got the income report and the cost report. So our notices, January 1st is our valuation date. We're responsible for valuing 76,500 parcels of real estate every year. So this is an annual process. Even though we only inspect once every 6 years, plus we have to reappraise every year. It's an annual process. And that appraisal is reflective of the market activity. The last several years have been really strong, so we've been seeing some increases in appraised value. And our goal is to accurately determine what these appraised values are, so we are fairly and equitably distributing that total tax base. So the indicators, we'll go through some of these. The median and average sale prices of homes in Shawnee County have continued to climb. You can see over the last several years they're climbing a little bit faster than they had in prior years. This is probably the most important reason why we have a low supply of houses available. So at the end of 2022, which our valuation date is January 1st of 2023, at the end of 2022, we had about 3 weeks worth of homes on the market. And 4 months worth of homes is what would be considered imbalance, which would be equilibrium between supply and demand. So historically, we've been running pretty low supply for a while, and believe it's catching up to us. I've spoken with a couple of brokers and economists and things like that, and they're all seeing the same thing, is that this supply is an issue. And it's not just an issue here, it's region-wide, nationwide. We have a supply issue. Something that may have helped a little bit is our mortgage rates. They have climbed quite a bit from the historic low years. As of January, they were about at 6.5. I think they've come down a little bit more since then. But when we look at this has acted to kind of cool the increase that we've been seeing. Our rise was meteoric going up, and I think this has calmed things down just a little bit. Homes are remaining on the market just a little bit longer, but we haven't seen any decline because of this. And when we look at this on a 50-year timeline, that 6.5% looks pretty normal. So the last 10, 15 years we've been under that mark, but the years prior to that we've been really significantly higher in a few of those years. Our cell counts are down from the prior year, but over the last 5 seems pretty normal. Again, this is the last 5 years with a supply issue as well. So nothing too out of the ordinary there. Our home permits are down over last year, over the last several years, which is exacerbating the supply issue. And then this is a map of the residential indications for trend. So I'm not sure how well you can see this on your screen, but this is identifying the different parts of town and the county that are seeing the specific general increases. So North Rural's at 11%, South Rural's 12%. We've got areas in town that are only 7 and 8, some areas that are as much as 14 and 15%. These are all analyzed by the areas that they're in. So we're letting the data tell us what's going on in each of those markets. After we've done all of that final review and determined the appropriate values, our total appraised value this year in Shawnee County went up just about, went up 12.83% to about $17.4 billion. This is overall appraised value. New construction added 190 million. And then this is breaking out the total value by assessment classes. You can see residential carries about 67.5% of the total tax base of appraised value. Commercial's at 13. Exempt property is at 16% of our total appraised values. So residential properties carry a lot of this. Residential properties includes apartments and manufactured home parks, things like that, that would carry a residential class.
Steve, I have a question. The not-for-profit, or I figure that includes schools and state buildings, federal buildings, what?
Exempt does.
Exempt does?
You can see we do have a not-for-profit line there, which is a separate category. Okay. So it's not-for-profit but taxable. But this exempt all would include schools and things like that.
Is that quite a bit higher than most counties because of all of our
I have not
buildings?
asked what other counties are. I would guess with this being a capital city that our number would be probably higher than most.
Yeah.
I can't say it's the highest though.
Okay.
You know, some of the Kansas City areas may have a pretty good chunk too. So then this is where it gets important to the whole process. This is the percent of assessed value. And so the assessed value is just simply taking the appraised value times the assessment rates. Residential is assessed at 11.5%. Commercial is assessed at 25%. Exempt properties you see are no longer here. That's because they don't carry an assessment rate because they're exempt. So commercial picks up that exempt property when we get down to the assessment rates. So commercial has 28% of the total assessed value. Residential is still carrying that 67. And if we add farmstead to that, which is really residential homes on farm property, you know, then we're at 69. So almost 70% goes to residential. And that is a total increase, a little bit lower, of 11.76% total increase, including new construction. So we break this out into the commercial and residential appraised values. Commercial has increased about 7.5%. Residential's almost 14% increase at 13.8. And again, the total including new construction is 12.83% increase in values. And then, you know, at the first of the year when we're finalizing our models and things, I was really nervous, and this is where I reached out to some of our real estate professionals and economists, and I was worried we were sitting on the edge of a cliff about ready to drop the bottom out of appraised values when you listen to the national news and things like that. So I got comfortable after speaking with the brokers, but I thought, you know, what are the other counties doing? So I put this together, and the interesting part of this is every county does their own analysis, their own separate reports, and it's all fairly similar. So, you know, we're at 7 to 15%, as we saw on our regular trend map. You know, Jefferson's 12 to 19, Douglas is 5 to 15, Wabaunsie's 12, Leavenorth's 10 to 15, Wyandott's 10 to 15. Johnson, we would expect them to be a little higher, and they're going up to 21 on a general trend.
On this, so I see that we have a range of 8% there. Other counties have a specific percentage amount. Is that just the way their appraiser phrased it to you? Is that the difference? Like you called them up and they said, it's 10%.
Right.
Okay.
Yeah, well, email traffic. But
Okay, right.
yes, and in some of these cases, they might have just a county overall trend because they don't have enough separation of data to identify multiple trends. So um, like Wabunsee and Morris. I don't know if they've identified multiple trends like we do, like Douglas, Riley County, things like that.
Where are we sitting right now in that trend? Are we towards the high end or?
Or lower than Johnson, it looks like.
Yeah, and so we're pretty well right in the middle of it all.
Okay.
You know, I think that county up north maybe didn't get high enough last year, so their increases stick out at 16 to 25%. That's the highest of those in the northeast Kansas region. So,
Steve, Jim Crow, County Councilor, is it all that surprising, given that every county you've listed has to use the same state mandated procedures
right,
in arriving
yeah,
at values?
no, it's not surprising at all, but I guess it's comforting to know that we're not out on that ledge on our own. So I don't know that makes any difference, but yeah, we all are required by Kansas statutes to follow the market value, and we all have the same oversight agency, so. Okay, we mailed 70,000 notices out, approximately, and approximately 91% of those properties will have an increase in value. But we didn't send out notices to everyone. Those that didn't have a change in appraised value or classification, we didn't send a notice. You know, back in the good old days, maybe 7 years ago, this used to save us a lot of money because our market was fairly flat and calm, so we didn't have every property going up or down. You know, we didn't have a lot of notices to send out. So I'd say we probably have saved over $1 million with this process over the last 20 years or more. But so even if we did send a notice out, but the property owner didn't get one, all they need to do is pull it up on the website. Our notices are out there. They can call our taxpayer assistance line at 232-4461, and we'll send them one. They can stop by our office, we'll print one, or they can send a request to snappraiser@snco.us, and we'd be happy to provide them with that notice. Our main goal is just to make sure everyone gets a notice that wants one. So the appeal deadline. So the last day to file an appeal at this level is March 31st. If you choose not to appeal at this level, you have the option to appeal when you pay your taxes under protest at the end of the year, or your second half comes due May 10th. So you could pay under protest at that point as well. But for this appeal cycle, that deadline is March 31st. And our phone lines opened up on March 1st. That number again, 232-4461, is our taxpayer assistance line. We have our appraisers answering the phone the first couple of weeks to help answer questions and schedule appeals. Many times people just want to ask questions. Since we started doing this, it's reduced the appeal numbers that we've had because people felt they had to appeal, just ask questions. And you know, we're trying to get the word out that we're a very approachable office, and any questions at all, come to us with them. You don't have to have an appeal to do it. You can decide to appeal after you have your questions answered, that kind of thing. So our appeal process, it's very informal. You speak with the appraiser, we go through our information, we listen to what the taxpayer property owner has to say about their property and why they believe our value may be too high or too low. We have had people appeal because their value was too low, or they thought their value was too low. But the reason I'm bringing this slide up, is to show that this isn't just a automatic rubber stamp, no change when you appeal the property. So this is a historic count of appeals that we've had over the last 15 years, and that orange line is the percentage of change. So, last year we had about a 40% change rate, but if you look at that line over the last 15 years, it's hovering in that 50% range. And why is that? Well, part of that is because, our goal is to get this value right. We don't care that it's high. We have no incentive to make that value high. We just want it correct, so it's fairly and equitably used to distribute the total tax base. But a lot of the times, these changes are a result of things that have happened inside the property that we're not aware of, that we can't see. And, maybe the basement flooded and the basement finish is gone. Or maybe we have incorrect data. They've got 2 bathrooms instead of 3. So it's information provided to us that can assist us in determining to make sure we have the correct value. So let's go over forms of taxations. We have sales tax, which, if sales increase, tax collection automatically increases. Income tax, if incomes rise, people get pay raises, tax collection automatically increases. With property tax, if appraisals increase, tax collection is still dependent on what the different taxing jurisdictions need in order to operate. So it's going to depend at during the budget process at the end of the year. The schools, cities, county, townships, how much money do you need to operate? And then we then use the assessed value to come up with the mill rate. Property tax is the only tax without an automatic increase. So that calculation, so jurisdiction's budget needs divided by the total assessed valuation equals the mill levy. And then that mill levy is taken times the assessed value of each individual property in that district to calculate that tax distribution. So this is why our appraisals being accurate are important. So, Aaron, you're not paying more in tax than your neighbor Bill, who has a nicer house than you. That's the important piece of what we're doing, is trying to fairly distribute this total tax base. And then the timeline of the appraisal cycle, property tax cycle, our evaluation dates as of January 1st. We mailed notices March 1st. The appeal deadline for people to talk to us about their value is March 31st. Then we must certify our values to the county clerk so that they have a tax roll of our assessed value. And then the budgets get determined, I think it's by August 25th. Not anymore. I knew it became floating, maybe even.
September.
Levies are set by November 1st. And then first half taxes become due December 20th. It's important to remember that December 20th tax is as of the January 1st valuation date. So there could be a lot of market activity that happens throughout the year that may increase values more or drop values, but that would happen at the next appraisal cycle and the next tax cycle. Property tax relief programs. So we get a lot of phone calls and a lot of complaints about actually low-income seniors and taxing them out of their house. I don't think this information is out there enough. We put a link to it on our website, and we're passing it out, but there are several programs that are there to assist. So the homestead property tax refund, up to $700. Its eligibilities for owned and occupied homestead with a total household income less than $37,750, You have to be 55 years older the entire year, disabled or blind the entire year, or have a dependent child under 18. Then we have the SAFER property tax refund, which is 75% of property taxes paid. It's for low-income seniors over 65, making less than $22,000 with the household income. And then recently passed through the legislation last year is the seniors and disabled veterans. It's a refund of any income increase in tax. So, you know, I think the base year was the 2021 for this refund. So any increase in tax above the 21 tax can be refunded under this program. So household income less than 50,000, 65 years old, or disabled veteran, and base year appraised value of less than 350,000. So the 2021 value would be $350,000 max house value that would make this available. So the important part of this is our office doesn't have anything to do with these tax refunds, but we know they're there, and we talk to more probably property owners, taxpayers than anybody else, so I'm trying to get the word out. But if they have questions, there's the Taxpayer Assistance Center with the Kansas Department of Revenue, or the Shawnee County Clerk, Ms. Beck's office, assist with answering these questions and can assist with filling out these forms. And I included the form number on this slide and the PDF that we have on our website. So, you know, the K40, the K40PT, and the K40 SVR forms for that information. You think you're pretty well done with this, and we're getting really close. I guess we can be done if you tell me we're done. But what I'd like to do is pull up our website and run through the valuation notice and what's available on our website. So our website, which I didn't say it out loud, is www.snco. That doesn't look right. SNCO/AP, but we can get to it from the county homepage. And we're right here in the middle of the homepage. You can see your value notice. Click on there. We have questions and concerns about your appraisal and that information here. But if we go to the search screen, and this is an open search, so you can search by owner name, address, quick ref. If you're searching by address, fewer characters are more important. So from this page, you can see the 2023 value, the 2022 value. We also have a picture of the home. We've got links for valuation notice. You can view it on the map. You can view zoning maps and sales information if you qualify. But the valuation notice, click on it, and it pops up, and it's just like the one we print out. So it's got the front page with current and prior year values, and then this back page gives a lot of information about the appeal process, including the important deadline date of March 31st. It shows what comparables we use to value the property if it's a residential homestead, and let's get back to here. It also shows all of the building data that we're using to appraise the property. So if people want to know if we have the information correct, You can go here and you can see, you can go through all the information and see what information we have regarding this. We provide all of our information out to the public. This is another good quality control because we not only get homeowners calling us about their own property, but sometimes we get homeowners calling us about their neighbor's property being incorrect. So it's good information to have. You can also see which properties we're using to compare you to, and it splashes them on a map. It gives their their actual sale price for the property and the adjusted sale price for the property. That adjusted sale price is if we were to adjust that sale to be similar to the subject property, that's its indication of value that one sale is bringing into the equation. And then we have county treasurer's portion of our website, the property tax information. And new to this, you can see what every year's property tax is that's available, but it also breaks it down into the different taxing jurisdictions. So you can see the USD 501 has a pretty good chunk. City of Topeka has a good chunk. Washburn University's there. Metro Transit, Shawnee County, but it breaks it out in kind of an easy to view graph. I think that's all I have, unless I can help answer questions.
Steve, you had mentioned, sorry,
That's fine.
in your last, or maybe next to last slide, a program for seniors. I'm unaware of that, but it does seem that the majority of the emails and phone calls that we receive are typically from retirees who are not getting an income increase at all, but are worried about their property taxes. And so that might be a good program to be able to tell people about. I don't see anything on your website about that program, though. Do you have links on here that are maybe easy to find somewhere?
We do, and it's out there. And it's under our main page. We could bring it forward to here, but right here is that link, right in the middle of the,
Oh, the
Top of
property
the
tax
page.
relief. Okay, I see it now.
yeah.
I didn't realize that was a link.
Well, maybe we can work on that to
Okay.
make it more recognizable. This information, I think, is also out on the county clerk's website.
So if, and I know that it's a state program and not your program, but just to clarify, if someone is over 65 or a disabled veteran, their house is worth less than $350,000, and they make less than $50,000 a year, then they would be eligible to offset any property tax increase that they receive.
Yes, that's the way I understand this bill, this
Okay.
legislation, this program.
It's a pretty valuable program. I mean, because most houses in Shawnee County are worth less than $350,000, so.
Correct. And most people that are needing to worry about this are gonna be under that.
Yeah.
You may know about this, but they are talking about increasing that income limit and the total appraised value at the legislators this year. I don't know if it's gone anywhere, but
Okay. All right, appreciate that. Thank you.
Steve, on these 70,000 notices we send out, do they have to be something that's mailed out physically, or can that be done by email? Can we shift?
again, in the legislators this year, they were talking about making it to where we can email them. I think there are probably companies out there that would assist us in developing the email list. That's probably our biggest hurdle right now, is we don't have an email list for everyone. But wow, that would be a big money saver.
Yeah,
So
I imagine that's pretty huge.
it is. I
Postal
mean,
line item there.
probably close to 50,000 to send out all these notices.
Yeah. You mentioned our supply of homes is low, and then our building permits are down. How many dwellings do you think we'd need to bring that back up to? Do you have any idea?
I don't. I think that's out of my lane.
That seems to be a problem I'm hearing all over, people not getting enough employees. Housing's
is.
part of the problem,
And for a while, our construction costs were skyrocketing, which I think limited the amount of new construction that we were seeing. And I think maybe that's eased up a little bit, but it's still an odd market.
all right. You have any other?
Sounds like we have more realtors than home builders.
Yeah.
I think we do.
I hear people jumping into that real estate market as a realtor, and I'm thinking, it's pretty tight right now. You guys fighting for homes to sell, so.
Well, Jim, do you have any?
I was just going to say, Steve, Jim Crowd, County Councilor for the record. Didn't you say typically you have around a 3-week supply now and you'd like to see more of a 4-month supply?
Right.
And then the numbers are going to differ depending on market parameters, price, and all of that. But right now, we're in short supply based upon time on
Correct.
market, for sure.
Yes. So, yeah, I guess we could try and do the math on that 3 weeks versus 4 months, but, I think a significant number of new homes would assist in our low supply.
Yeah. Well,
Steve, I've anecdotally heard that the city council might request you to come give this presentation to them. Have you heard from them yet?
I have not.
Okay.
I don't think it's a bad idea after listening to some of the meetings last year,
Okay.
but,
Steve, okay, I'm sorry.
No, please.
You're required to appraise every property every 6 years. Is that agriculture, or is that homes, or is that everything? Or?
well, yeah, let me correct that a little bit. So we're required to inspect every property every 6 years. We're required to appraise them every year. Agricultural is another regulation that we have to follow, and it is every 2 years that we have to review the agricultural use properties. So those agricultural properties are more often than that, once every 6 years. But yes, every property in the county, so.
When you appraise a home, is that a drive-by kind of thing, or do you stop? Do you have to, what all's involved in doing an appraisal of say, an existing home, your standard home?
Of an existing home that we've been to a bunch already, that includes driving by the property with aerials and information about that home, to review it, update our photo, check for any changes with the property. But we're no longer required to get out and remeasure the house, except for sales information. With sales, we measure every improvement on the property.
We approved some software, I don't know, it was a year or two ago, where it would see changes in the footprint of an aerial photo. Has that been a good thing?
Successful?
Successful, yeah.
It was successful. It created a lot of work for us and the planning department. They complained about it a little bit. But it was successful in more than one way. We were able to see some things that we missed, but we were also able to identify reasons why we were missing them. Some of it, is beyond our control, such as right after we inspect the property, then they build a big addition with a pool, and so we won't catch it for probably 6 years unless they sell the property. So, and they didn't take out a permit. So it's things like that, you know, that it was helpful that it caught. Lee Allen, our GIS guy, we're looking at getting him some software that will allow us to do that in-house, so it's not such a big project, but it's a regular thing. And our inspections, one of the reasons why we take out current aerials for those inspections is so we can help identify any changes that have occurred while we're visually inspecting that property.
So I have a question about commercial real estate. How are the valuations done on that? So I just went ahead and looked up some of our like large commercial properties, like a Goodyear, Frito-Lay, and some of those. And it appears that like their valuations don't change really much at all. Is that because there's no comps? Like people are not selling large factories in Shawnee County. So are they just kind of stuck at whatever they were built at, or?
Not exactly. Those are the more difficult properties that we have. And we've gone outside and gotten appraisal assistance on those, and so we use those as the basis for our values. Goodyear, as an example, is just a monster property that you know, we're really unsure of what that value would be if Goodyear pulls out. You know, if it's not, if they put it on the market, it's a huge monster property that has just kind of been Frankenstein together over the years. And Frito-Lay is another good property that has a lot of additions to it throughout the years. And I don't know if their economic development exemptions have expired on those or not, but they've had those throughout the years too. So in some cases, we need to get assistance from outside to appraise some of those.
Okay.
This is Jim Crow, County Councilor, and again, you're not valuing the business interest. You're only valuing the real estate, even
Correct.
on commercial property.
Correct. But, you know, we'll look at the replacement cost new less depreciation. And while we can model depreciation for most properties, those kind of fall out of that normal, probably depreciation. But you know, we do have a cost approach estimate on them.
Any other questions? Well, thank you, Steve. And,
Thank you.
I think that's, it's been a good work session for item anyway. I've learned a lot today, so thank you very much.
Yeah.
Well, it's a stressful time of year for a lot of us, so.
As Steve says, next. We have the Health Department, Teresa Fisher, and you're going to talk to us about some of your grant applications, is that correct?
Yes, good morning, Commissioners. Teresa Fisher, Director of the Health Department. So we'll change complete gears from the presentation we just heard about. So this is our annual application to the Kansas Department of Health and Environment for the aid to local grants that we apply for. Typically in the past, I've brought what I would call the 30,000-foot view and given you just a very broad overview of the grants that we apply for and just a little bit of information about them. So this work session, I think, affords us the opportunity to get into what I really call the street view. And so today, the grant managers are the ones that are actually going to be presenting the bulk of the program today. So you will hear from them directly about the specifics about the programs, what the programs do, the staff that run the programs. You'll hear about the funding for the applications, whether it's a competitive grant or it's a formula-based grant and what that formula is based on. And then you'll also see in several of the slides, really how the grants over the past 5 years are not keeping pace with our staff salaries. So we also have our accountant, Amanda Neosy, who's here today. She and the grant managers and myself worked really hard to put the budgets together that you'll be seeing today. This is our total grant request for this state fiscal year. So you will see last year, it is an increase over what we requested. And as we go through all the slides, the grant managers will break this amount down for you. You'll note that we received less than what we applied for last year. I would say that is fairly typical. It's very unusual for us to receive everything that we apply for, whether it's a formula or a competitive grant. So again, they will break those down for you. So with that, I'm going to turn it over to them. They drew straws as to who's going first, and I think Craig drew the short straw, and he's up first. So.
Well, I missed the straws being pulled, but no issues with that. So, Craig Barnes, Division Manager. I'm over the Community Health Outreach and Planning Program. So today I'm going to talk to you about 4 of the grants that we received through KDHE as part of the Aid to Local process. So starting off first is childcare licensing. So as you see here, our childcare licensing program is a regulatory program that licenses all childcare centers, preschools, homes, drop-ins, things like Boys and Girls Club, and programs of that sort. So as you see on the second point right now, we have 309 licensed providers in our community. That number has significantly dropped over the last handful of years. When we looked at it back in 2018, we had over 400 licensed childcare providers here in Shawnee County. So we've seen that number drop by over 100, and COVID exacerbated that as well. So. What you'll see, we requested a little over $300,000 in grant funding for this year. That covers salaries and fringe for 4.5 FTEs of program staff. That's a team leader, part of an account clerk 2, and then 3 surveyors to get out. As you can imagine, that's a lot of time in a vehicle getting out to do inspections annually for 309 licensed providers in the county. So, and that doesn't take into account complaints and other things that we get that are come down either to our office directly or from KDHE that we follow up on. So total program costs just north of $350,000. So that's the grant itself. One of the things that's unique about this grant in comparison to other grants that we apply through the Aid to Local cycle is specifically that, so when we request, they ask for all of our operating expenses as a part of the grant. And so that is the full expense of that, even though, as you'll see here in a second, they fund nowhere near the cost of what it takes to fully run the childcare licensing program. So funding for the childcare licensing program is based on a formula. And that formula is the population of children under the age of 15, number of child care cases as of March 2023, and then the child care capacity. So each center supervisor or home has a number of spots based on how they're either the degree that they have or time in the program. And so that number can shift based on new providers opening up, whether that's a center, obviously that capacity is higher. If it's a home, you're looking at a smaller capacity for those settings based on just the nature of the business and staff that you have on site. So. And then one of the unique things that the Child Care Licensing Grant does as well is they provide a bonus, funds that are available based on our surveyor qualifications. So we typically get some bonus funds that are on the higher end of this just because we have well-trained staff here in our community that have degrees in either early childhood or have, like our staff right now, a lot of our staff actually were former child care center operators or worked in centers or had daycare homes, and so that experience goes a very long way, and we're able to tap into some of those bonus funds that way. What you'll see here, I think, call attention to this picture is our team leader, Jennifer Zimmerman, for child care licensing, and that is one of the quarterly free orientations that we did. So you can see very well attended. Those are all prospective new child care operators, whether that be in a home or in a center. So excited to see. I want to make sure I shared that photo to show that We are actively out in the community doing community engagement. We are partnering with the GTP and as a part of their child care task force for Momentum 2027 that is looking at recruitment opportunities to increase child care licensing opportunities here in our community. So the next slide here, this is a little bit, kind of Teresa alluded to, is the operational budget as it relates to just salary and fringe benefits for the staff that we have, and then the funding that we receive. And so you see the grant awards have stayed pretty steady, especially the last 3 years. We've gotten $167,000 there, but operating expenses are double that, as we alluded to on the first slide. And so salary is up there. One thing that I want to mention is, the other thing that's specific to the grant is that we can get dinged based on compliancy. So how quickly we get out to inspect or how we handle complaints and things of that sort. And we have to stay with above 90% compliance in response to those issues, right? And if you aren't staying compliant, then you can lose funding through that cycle. One of the nice things is the county has typically always stayed compliant with that. One of the things that we tried a few years back was reducing the staffing, right? Instead of 3 full-time surveyors, we decreased down to 2.5. That was one of the times we couldn't stay compliant. And so we know to stay compliant within our county here, the staffing that we have is an adequate representation of the work. And just kind of to give you an idea, this is the compliance contract that comes with KDHE, that everything has the regulations and everything that the surveyors are looking for to maintain compliance on a yearly basis. So a lot of paperwork and things of that sort to read through and make sure that we're up to snuff on that. So that's child care. Do we want to take questions, any questions as we go through before I move into another grant? Any questions about child care licensing? Yeah, Commissioner Rippon.
You mentioned that we dropped almost 100 providers. And you said COVID was the main, or one of the main causes for this drop?
Yeah.
What was their thought? They couldn't operate during that time period, so they just shut the door? Or
There's a lot of different reasons, and I can't sit here at the podium and say one given reason for why folks did that without, I think, diving a little deeper into it. We just know from the data that showed that numbers decreased 2020, 2021 significantly during that time. Some of the feedback that we got was just simply, workforce isn't there, and so they were not able to hire staff to fill some of those vacancies for those in the child care centers. So we lost some of the child care centers, as well as in the homes. They just shifted due to family needs and other things of that sort.
Mr. Chairman?
I think a lot of people are working from home and weren't sending their kids to daycare also.
It's another good point.
And
Yeah.
so, I mean, there's just, if you're running a daycare center and
Your kids are being
30% of the kids stop coming, I mean, it maybe doesn't make sense to do it anymore, so.
What I'm hearing from a lot of large companies that can't fill the lanes with workers now is that's one of the problems.
Yeah, I think a great example is what Stormont Vale is doing with their building blocks. They added a second location, and they're using it as a recruitment and retention tool of having that as 2 locations that are available for their staff. Here's a location in close proximity to the hospital. You can bring your children here, infant through 5, and prices for their staff are a little lower. And so they're using it as a recruitment tool.
Mr. Chairman,
Yes.
Craig,
Yeah.
licensing.
Mm-hmm.
Licensing usually goes to daycare centers and daycare facilities. If Commissioner Mays is running just an at-home daycare, is he going to fall under Shawnee County licensing, or is it just, Commissioner Mays's daycare center?
Yeah, no, if you have a home daycare, yeah, you are required a license here in Shawnee County. So we do license home daycares, centers, drop-ins, the whole gambit. Other questions, child care licensing? Okay. So the next grant program I want to talk about is our chronic disease risk reduction program. So this is the grant program through KDHE that funds a lot of our evidence-based policy system and environmental work that is focused around tobacco use prevention, physical activity, and nutrition. As you see here, we requested for this cycle $76,326.39. And then program costs run just a little bit higher than that. And then we have a 25% required match as a part of this, as this grant as well. So in the years past, we've used funding through this to work with multi-unit housing partners for smoke-free apartments, most notably the Topeka Housing Authority, which was the first housing authority in the state of Kansas to go 100% tobacco-free. They've been a great partner with us over the years, and they won an award from the Kansas Public Health Association for the work that they did there. We've done this to host focus groups and neighborhood conversations as are related to tobacco use prevention efforts, as well as around physical activity and nutrition. We were able to kickstart the East Topeka Farmers Market many years ago with funding coming from this. We've also used it to do analysis of like the food system environment in Shawnee County, partner with our friends at Parks and Recreation, and numerous partners throughout the entire community around a lot of different grant initiatives. One thing that's so different for this grant comparatively to a lot of the other grants that you'll hear about a little bit more is this is a competitive grant cycle. And so for this specifically, communities apply for funding based on the activities that they will work on. You can work on up to 5 grant activities in a given state fiscal year, but a majority of them have to be in the realm of tobacco use prevention. So if you are going to apply for, say, 5 grant activities, you would have to have 3 that would come from the tobacco use prevention program, and then your other 2 could either be 2 physical activity, 1 physical activity and nutrition, 2 nutritions, and you do not have to apply for all 5 of the activities. You can apply for any number between 2 and 5. And so, for example, this year what we will be applying for is 3 grant activities, all focusing on tobacco. And that's basically based on capacity and partnerships and the work that we think that we can accomplish in a given grant year. So we'll be working a little bit more on smoke-free multi-unit housing, tobacco-free multi-unit housing in our community, partnerships with our mental health partners, and adoption of the Kansas Behavioral Health Tobacco Guidelines. And then another grant activity that I am blanking on right now, so I apologize. It'll come to me though.
Craig-
Yes, sir.
Craig, would vaping come under this? or-
Vaping is definitely, yep. And so thank you, because the other partnership that we're working on is a partnership with the school districts to review and provide technical assistance on their tobacco-free policies to include vaping, and then provide presentations in the schools and look at, we're actually in discussions with the district attorney and the work that he's doing with the school districts on the tickets that are happening within the school districts, and a diversion program through Judge Devanovich, his courtroom. So yes, vaping, definitely, something that we're tackling head-on right now. So a little bit more on the funds. They're allocated based on a scoring rubric. Partners not associated with KDHE from state organizations across the entire state review the grants, and then they use the scoring rubric that's applied and given to them by KDHE, and then so you get an application score, you get scored on your past performance and the work that you've done in this area before, and then of course the population size, which I think you'll see is a common thread across a lot of KDHE's grants, is based on population size. So quickly looking at that, red line here again is salary and fringe for the staff. What we try to do, and so this position itself will be funding 60% of our health promotion coordinator that work, and so 60% of her time is dedicated in CDRR initiatives, and then obviously other health promotion positions or programs as well. A health promotion specialist, which you'll see for 2023 right now, that number is a little lower because we've had a vacancy in there and we're holding off on hiring that position until after the first quarter. But you'll see grant awards have ranged based on the work. I'll be truthfully honest with you, during those COVID years, we did not have a lot of staff capacity to do a lot of the community engagement work in this realm of health promotion. And so we had lower grant awards those year. Partially, we requested less as well, just because we didn't have the staff capacity to do as much in those realms. And staff, our health promotion team, was actually diverted into other COVID duties at that time. So that is that. Any other questions on chronic disease risk reduction before I move into our preparedness grants? Okay. So the next two grants go hand in hand, really. We have a local public health emergency preparedness grant that we see, and then we are the fiscal agents for our regional public health emergency preparedness dollars here for what's called the Northeast Corner Regionalization Initiative. So our local public health preparedness grant here funds two positions, one of our emergency preparedness community outreach specialists at 100%. And then the other one at 60%, and that's because her duties are split between the local grant as well as regional grant components. So the preparedness grant does a lot of work, obviously, with preparing our community resiliency. So there's a lot of strong partnerships with Dusty's team in emergency management. March is Severe Weather Awareness Month. This week is Severe Weather Awareness Week, so we'll be pushing out a lot of information about being prepared in the case of weather emergencies. It's Kansas, we have a lot in all given parts of the year. And so we do a lot of community resiliency work there to make sure that not only our internal staffs and county staff, but also the public are well prepared in the case of any type of emergency. They do a lot of, obviously, planning and exercising as well, exercising policies that we put in place, managing our continuity of operations plans, our risk communication plans, and emergency operations plans within the health department, and to maintain those crosswalks between through our health and medical partners through what is called our Emergency Support Function 8, which is our health and medical annex. So this team was vitally important during COVID of creating those conversations and those partnerships with our long-term care facilities and our other medical partners throughout the entire community, doing training on PPE, providing avenues to get materials and PPE to them when they maybe were not able to through the Strategic National Stockpile. So I kind of talked a little bit about that, the FEP capabilities. Funding is based on population here. And so the funding that we see is pretty stagnant across year to year. The only time you ever see any increases in that is basically when the federal allotments are larger that come down to the states. And so right now, we don't even know when this is one of the different grants where we apply based on what we received last year, because we don't know what the funding calculations, they have not been finalized yet for either of our two FEP grants. And so we applied based on what we received last year. And so typically you'll see me come back to commission later after we've already applied, because they'll send us a notice of award that is different sometimes than what we applied for. And so we have to come back and get a different approval from you all to accept that dollar change. So the grant, like I said, focuses on compliance, local, state preparedness capabilities, and I mentioned too that it coordinates the SF8 annex. So you'll see here our local FEP, so salaries have stayed pretty steady over the years. We've got some newer staff there, but you'll see grant awards is really covering just salary and fringe at this point in time, and so operational expenses are being covered by our operating budgets or through other opportunities. And so one of the things I think that you'll notice throughout here is grant awards are either staying static or not nearly increasing at the same rate that salaries are increasing. And so that is making the old adage for public health is do more with less. That's kind of been the case. You're seeing that with some of the funding that's coming through because it's not really increasing. Regional FEP, as I kind of alluded to, we oversee both a local, but then we oversee our region's grant dollars as well. We are the fiscal agent for that partnership. You can see the 7 counties that make up the Northeast Corner Regionalization Initiative here. And so with us, we have some more internal capacity, obviously, to manage not a large amount of dollars, so $43,000 there, but that does fund the other 40% of the EPCO specialists that we have, and she coordinates and provides technical assistance between KDHE and all of the other 6 counties to maintain compliance with their local FEP grants, which is a great partnership. One of the nice things about this is the grant awards do allow a little bit more flexibility in providing covering some more tangible expenses to be able to provide trainings and do exercise coordination. We had, again, a great partnership with Dusty Nichols in Emergency Management, who actually helped lead an exercise at their last meeting, which was in compliance with one of their action steps for the local FEP grant. So And then typically you see funding from this send an administrator or a FEP grant manager from one of the 7 counties to the national prep or FEP conference every year. So that will be happening here in April. And I think, yeah, that's it for my 4 grant domains. Any questions that I may be able to answer for you on either of or any of the 4 grants that we covered today? No?
Good. Thank you.
Okay.
Thanks.
Thank you.
Good morning, Commissioners. Carrie Delphs, Clinical Services Division Manager. My first aid to local grant is family planning. This was a program that we finally got off the ground about a year ago. We were able to start seeing patients after applying for this grant for several years, and then disruptions with COVID just slowed that work down. So the Title X Family Planning Program really at the basis is assisting individuals and couples in planning the timing and spacing of children. This helps improve birth outcomes for women and children. This grant's administered by KDHE, and priority is given to state, county, local programs, and then additional funding could be allocated to hospitals or qualified health centers. So some general requirements with this grant. Of course, we have to have that skilled personnel providing the services. We create and maintain an advisory committee on information and education. So that is any patient information we're passing out. We want to make sure that it's factual and appropriate. Providing community education about family planning services, maintaining our pharmaceuticals in compliance with the 340B program, and then establishing a schedule of fees and discounts. So this allows us to provide services on that sliding scale. So not as much previous year history, but you can see for the past 2 years, we had requested more than we had received. Our award had stayed the same, about $87,000. This year we're requesting $200,000, and this does have a required 40% match. Any questions specific to family planning? All right, state formula. This one is, I wouldn't say a free-for-all, but it's really given to local health departments with the intent that they spend it how they need it, where they need that funding. So we've historically used this for staff in my clinical services program that don't have specific aid to local grants that cover the type of the work they do, like disease investigations, STI treatment and testing. This is an allocated amount. It's based on population and the tax allocation that we receive. And this year, we already know we're going to be allocated about $236,000, and that's just a slight increase from last year. And then my final grant is the Immunization Action Plan. This is allocated to local health departments that are participants in the Vaccine for Children, or VFC program. This, again, is an allocation. It's based on the number of Shawnee County children we have enrolled in Medicaid, as well as how many doses we had administered in the previous year. So you can see in 2022, we administered about 4,400 doses to about 1,600 children.
Carrie, on that slide.
Yes.
We get 89 cents for each kid that's in CHIP, and then $1.85 for each vaccine.
Yes.
Does that cover the cost? I mean, it seems like really low.
So part of being a VFC provider, it's federal program, so that vaccine is provided to us at no cost.
Okay.
Of course, there are the costs, to administer, whether it's the syringes, alcohol swabs, the refrigerators, the storage it has to be kept in.
So no, this does not cover, the cost of operating the entire immunization program. And then we also expand services beyond just our VFC, where we offer private vaccine as well, travel vaccines, TB skin testing through our immunization services.
Okay, appreciate it, thank you.
And then, along with VFC, so we cannot bill for the vaccine since it's provided to us, but we can bill the administration fee, which is about $20.25.
Okay.
Any other questions? Thank you.
Save the best for last. Actually, my name is Missy Bendorf. I am the Division Manager of Family Health, and I've been in this position for about 7 months, so it's my first time getting to speak with all of you. So in our family health, we have the maternal child health program, and that is where we get our aid to local grant money to run those programs. So we requested the, sorry, I can't see that, $388,925, and this is a required 40% match. So we get the total cost of $544,495 that you see there. And so this grant covers several programs in maternal child health. We call them the First Steps, which is a home visitation. We also have newborn home visits, and then we have our baby basics and our infant mortality program. So all of the staff that work in these programs is covered by this grant. And this is a formula-based grant funding. So even though I fill out a 33-page application every year, they tell us that, you got all but 5 points, I think, last year on my application, which was really good, and I was so proud of it, but still it's based on this formula. So the formula is based on a population of the children 0 to 22 in your community, females 23 to 44, which is that childbearing age they consider, and number of children under the age of 18 living in poverty. And they base this off of the U.S. Census. All right. So here is my graph of showing you salaries and fringe versus what we get from the grant award. So since 2019, our grant award has not changed. We have received the same amount since 2019 and continue to have increases in salaries. And then obviously if you ever hire somebody with some experience in nursing, we pay them a little more. So that is just our salary and fringe, and then that doesn't include what it costs to actually run the program, pay gas mileage for the people that go out and to visit, and then also all of our supplies to the nurses to have stethoscopes, training, all that. So that's why we also need more than the $505,000. So our staff in the maternal child health includes myself, the team leader. We have 2 full-time social workers, 2 full-time RNs, and office assistant that we share with other family health programs, and then our Spanish interpreter that we also share with our other health, family health programs. And so here's a look at some of our numbers in 2022. Our total MCH client encounters was 292. Our baby basics participants was 28. With one of those in January, we had to go to virtual, and then the rest were all in person. And then our fetal infant mortality cases reviewed were the 19, and we meet once a month and review over those cases. And so we need an RN to abstract that information, and then we have a social worker that offers a in-person interview with the family that's experienced a loss. And then all of us come together to present those cases to community partners that we've invited to that case review team. And then our outreach activities, we do car seat check lanes. We have one actually coming up in April that we hold at the health department. We do those 3 times a year. Community baby shower, we're always a big part of that. And our vision screens, we try to partner with different schools here in in Shawnee County, and we offer a vision screen, or we go out into the community and can do those at health fairs, and then any other Shawnee County events that we might be invited to, like that parents, teachers might put on and invite us. We send staff out to represent those. Stormont Vale does a baby jubilee twice a year. We always have a table and represent and give our information to those. Any questions?
I've noticed a trend, and a lot of these grants, they're not keeping up with salary. Are they administered through KDHE? Is that
Yes.
usually? Do they have a annual review of what for their funding for these grants, or how does that work on the state side, or is that, do they get money from the feds and then they redistribute it?
Yeah. They told us in a meeting this year, when lots of people are asking this question, that they are going to look at a different formula in 2024, and that's all I've been told. Teresa might have more information, but that's what they told us, at least about ours for maternal child health, that they realize that that's not keeping up, basing it on just population sizes.
Okay.
They didn't ask for any local assistance in determining that formula?
Of course not.
Commissioner Riffon, I would say that yes, several of these awards are federal government awards that the state gets, and then they are passing through to the local health departments. So, this slide just is a comparison of all the grants that you've heard today. So I would draw attention, we do have a couple of our COVID grants on here, these ELC grants. Those, we just found out within the last week, we've got a couple that are going to be extending over into next year. We, prior to that, thought they were ending at the end of this fiscal year. But I think there's some local health departments that still need some time to expend those dollars, and we likely will take our time expending those in the most efficient way. But you will notice there are no grants that we are applying for of those. So that's a huge difference for our department. These grants have been with our department since I became interim director, I would say. So this is a large stream of funding that we are losing in part with that. So these individuals that you just heard from, not only our leadership team, our division managers, our grant managers, these are our grant seekers, these are our grant writers. And so trying to find grants that are out there that really help supplement the work that we're doing. You've heard them say, we still have staff vacancies, and so we have to make sure that the grant fits with the work that we're already doing. It doesn't make sense to go get a grant, and if we don't have the staff to carry out the work that's needed. And so, sometimes the turnaround time, though, is a short turnaround time, and the ability to get it through the commission, being able to write a quality grant application, because most of those grants are going to be competitive. But nonetheless, we, I would say weekly, are perusing, seeing what we can find. We've got some identified spots that we are looking for grants and seeing what might be out there to help supplement these. But a lot of work goes into writing these grants. Yes, I think Missy takes the award for the largest grant application, but I'll be back on Thursday to present this for your official approval to submit to the state next week. And it's I would say, a robust packet. It's almost 200 pages of application work that's gone into the last several weeks and months that these individuals have been working on it. So with that, thank you for your time. Are there any final questions that you have about any of the grants you've heard about today?
Does each little area or division, do they write their own grants, or do you have one person that's sort of the grant writer? And
No.
They're all
The
grant
individuals
writers?
you heard from today are who wrote every single grant they spoke of.
All right. Okay.
Okay, thank
Thank
you.
you.
I'll
Thank
see
you
you on
very much.
Thursday.
All right. Another good presentation. Thank you very much. Next, public comment. Do we have anyone who would like to speak on any subject? Nope. Administrative communication? Nothing? Okay, we are adjourned.